Each year there are over 200,000 ACL injuries in the United States, 70% of them being non-contact type injuries. Luana here was in a skiing accident and tore her ACL. A lot of times when athletes or people are landing on the ground, their knee gets put in a position where the knee kind of is bent and the femur internally rotates, the knee collapses inwards. And a lot of times that ACL cannot take those forces. Luana did 6 sessions before her surgery in order to restore her range of motion, get her quadricep muscle to fire properly, and also walk normal as well. A lot of the current research indicates that accelerated rehab protocols really help the patient achieve milestones a lot faster when looking at range of motion, quad function again, walking, progressing into more functional activities such as a squat and a lunge. Luana started physical therapy 3 days after her ACL reconstruction. Her and her surgeon elected to use a hamstring graft as far as the new ACL graft. The doctor has you wearing the straight leg brace. The reason is as your quadricep muscle is a little bit weaker, we want to make sure that knee doesn't buckle. Most doctors want their patients in a brace for about 3 weeks at the most, but also sleep with this on at night as well. Okay. I'm just going to grab a couple measurements and we'll kind of dive into some treatment, and I'll talk to you a little bit about what we're going to do today. Incisions look great. Definitely have a little bit of swelling, but totally be expected at this point. So as you can see on this leg, when you fire up the quad, you get this nice little teardrop that comes to the inside of the kneecap. So on this side, anytime you have a knee surgery, that quadricep muscle gets inhibited. So what we want to do is really try to get that engaged and get that turning on again. So I'm going to take a couple measurements though. We'll start with some swelling and compare to the healthy side as well. The biggest thing that I noticed right away on your knee is it's pretty tight in the back. Okay, as you can see on this side, I can't put my hands here, but on this side I can kind of get my fingers there. So the calf muscle actually comes up, attaches just above the knee. Your hamstring comes down, attaches just below the knee. So when there's surgery, you have swelling, and it kind of makes the knee sit in a slightly bent position like this. So the hamstring and calf have just gotten really tight. If you remember pre-op, you have the same type of thing where that hamstring was just really tight. So we're going to spend a lot of time really loosening that up to restore that. The reason why that's so important is the knee, in order to get that quadricep firing, see how straight that knee has to be, and you have a little bit of hyperextension, which is what we want to restore the knee to. We're going to start a little bit of massage kind of on the back of the knee and really try to loosen that up. And you're just going to try to let that leg relax, let it kind of just fall down. The only time you're going to have a pillow under your knee like this is when you're in PT like this. You don't want to be at home in this position because the back of your knee, the calf, the hamstring, what we're just loosening up, it's going to get really tight and you'll lose that extension. Okay, so when we get done, we're going to start icing. We'll actually be in this position, okay, because the gravity will help push that knee to get extensions. So after we've spent a lot of time trying to massage those muscles to loosen them up, we're going to stretch them actually now, okay? So the first one we're going to do is a calf stretch, and really kind of targeting this area. You're going to grab this strap, you're going to hold with one hand. If you want to sit up a little bit for this, there you go. So you're going to pull back with one hand and then use the other hand to try to push that knee into extension, okay? So you probably have a little bit of discomfort at this at first because it's so tight in the back. Well, we want to hold for about 20 seconds. You're going to do that 3 times. So that was a calf stretch. We're going to stretch the hamstring now using the same strap though, okay? So let's bend this knee to take pressure off the lower back, and then we're going to use this strap to kind of loop around the foot. So holding the leg up using the strap, and then you'll use the other hand to try to push your leg into that extension. So kind of pulling back on the leg and pushing at the same time for a nice gentle stretch of the hamstring. So let's try 20-second holds, and we'll do that 3 times. We're going to use electricity now to help stimulate this quadricep muscle. So this guy right here, when you fire, it's perfect. And this side, when you try to do the same thing, because of the knee surgery, the quadricep muscle gets inhibited. So we're going to create a local stimulus, particularly this inside little teardrop that connects, kind of runs and connects to the inside of the kneecap. I'm going to put a pad right there to start to get that to fire. So yeah, when that kicks on, try to tighten up, pushing that knee into the table, really get that muscle to come up. And then when it's off, you can just relax. Something easy you can do at home, I call it the hand test, but basically trying to slide your hand under your knee. So if you can slide it under the knee, that means you haven't achieved full extension yet. But this looks pretty good on you. As you can see, my hand's getting blocked on this side. So even with the heel propped a little bit, the extension looks pretty good there. So we're gonna take the machine off now. The idea is you're gonna try to fire on your own without the machine. So you get a little bit of carryover from the machine to retrain that quadricep muscle to really engage. Get a little bit of movement. Doesn't seem like a lot, but so 5-second holds, and you're gonna do that 10 times. Good, tighten up, tight, 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 tight. Good. How about I lie down flat for the next exercise? We're gonna bend this knee. Try to engage that quad. Keep the knee nice and straight, but you're gonna lift it up at the same time, okay? So I'll help you out. Lift it up. Good, 1. Up again. Up, up, up. Up. That's all you. What you oftentimes see is, it's called a lag, but you're lacking that full extension while you're doing it. That'll get better as the quadricep muscle gets stronger as well. I'm gonna start to kind of move around your kneecap, okay? The reason why that's important is when you straighten your kneecap rides up the femur a little bit, and when you bend the knee like this, we're gonna bend the knee, kneecap slides down. So we wanna make sure there's no scarring that occurs kind of under that kneecap. As you can see, that straightening of the knee we keep talking about is so important to get that quad in order to engage. So we want that kneecap to be able to move freely. So it might be a little bit tender, just let me know if it's too much, but just trying to wiggle this kneecap around a little bit. Some exercises that I'm gonna give you at the end, this is one of them. You can actually just kind of take this kneecap and wiggle it around yourself. This just helps to prevent any scarring that may occur around the kneecap. We're gonna work on the bend of the knee now. So you can actually use this leg to kind of hook under this leg in order to support the weight. We'll have you sit up and you're just gonna swing your legs over to the edge, so you're sitting at the edge of the table, okay? Awesome. In this position, you're just gonna allow this leg to control that knee bending. So we're just using gravity to help assist bending the knee. So I'm gonna keep my hands here as well. You know, I won't drop you or anything like that. So when you feel like you get to a point where it's a little bit tight, then you can back it off, come forward a little bit, and we're just gonna repeat that, okay? Let's see what gravity will allow us to get, but with this, there's really no restriction coming down. Our goal in the first week of physical therapy is to get you to 90 degrees of bend and about 10 degrees each week after that. So by weeks 4 and 5, we're at full range of motion. So we spend all that time doing the massage and really loosening up the knee before we start bending, so it'll, you know, less pain and also better elasticity out of the muscles. So we'll take the weight, there you go. You can just let this other leg relax. There you go. A lot of times the quadricep muscle is really tight and it's trying to fire to guard bending the knee because you've had pain with it. So when you get to a point where gravity won't take it any further, now you can use this leg to try to bring it back. Does that make sense? So you use this leg to kind of push it back and do what I was doing. So doing this 3 or 4 times a day for about 2-minute durations, 2-minute intervals is really important. We're gonna finish up with a little bit of ice. It's just gonna help to reduce your pain levels and also some swelling in the knee, okay? You can ice 4 times a day, 15-minute intervals. As you can see, the position we're setting you up in is with that heel prop to really force that knee into extension, okay? Get right on that hamstring, so hopefully that'll reduce some of your pain. Does the weight of the ice packs feel like it's pushing down a little bit? Okay, excellent. To recap what we've done today, it's crucial for the patient to come in 2 to 3 days after ACL reconstruction. What the patient should never do at home is lie or sit with a pillow under the knee so the knee is slightly bent. That will cause a lot of tightness in the back of the knee and restrict the mobility in the knee as well. The exercises to focus on at home include the calf stretch, hamstring stretch, quad sets, good, tighten up, tight, 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 tight. Straight leg raises, kneecap stretch, passive range of motion or bending the knee, sitting at the edge of a table or a chair, and finally icing with the heel propped for 15-minute durations 4 times a day.